Hey everybody, it's Dr. Hilpisch. Today we're going to talk about post-concussion syndrome. When a person gets in trauma, it might be a whiplash, it might be a fall where they hit their head, it might be any number of sports injuries. The brain is forced against the inside of the skull. It produces swelling, so you have a concussion. That should heal itself within 2 to 3 weeks after the accident. Many patients have lingering symptoms. It's called post-concussion syndrome. So it might be dizziness, lightheadedness, foggy-headedness, irritability, anxiety, trouble sleeping, migraines. That is because the same force that rattled the brain inside of the skull also knocked the upper neck out of alignment. That's called a subluxation. So the Blair technique, obviously what we do here is very, very accurate and specific at finding that misalignment. There's a backup fluid, so every time your heart beats, it's supposed to be pushing this fluid around the brain and down the spinal cord. So if it's out of alignment at the top of your neck, it actually clogs it. There's actually an internal pressure around the frontal lobe, and that's where all these functions come from. So it's super essential to any patient that's had trauma to evaluate the upper neck for the misalignment. It's very simple. We take the x-rays, we realign the upper neck, and then it's like draining the swamp, so to speak. The pressure from the brain is resolved once the bone moves again. So if you had trauma, you know somebody that's dealing with these types of issues, please tell them about what we do here, and we'll get them evaluated and get their lives back on track. Thank you.